Do you guys have any experience like this? How long does it take for you to sleep when you lie down in bed? 10 minutes? 30 minutes? 1 hour? Or do you wake up many times during the night and have poor sleep? You are almost likely to suffer from a medical condition called insomnia. But don't worry, you are not alone. Insomnia is the most common of all sleep disorders since there are millions of people around the world suffering from insomnia. Hello everyone, today's video will be about insomnia. Hi there, Umay from Cloud Hospital TV. And in the next 6 minutes, I'm going to talk to you about insomnia. What is it, causes of insomnia and symptoms, as well as diagnosis and treatment of this common illness. And before we start, please subscribe to our channel so the next time you will be updated with our new releases. So, what is exactly insomnia? Insomnia is sleep disorder in which you have troubles with initiation, maintenance or quality of sleep that occurs despite an adequate time. Everyone is exposed to insomnia at least once. You may have severe insomnia that usually lasts for several weeks, or chronic insomnia in which you have difficulty sleeping at least 3 nights a week for more than 3 months. So what causes insomnia? You may ask why this happened to me. What is the cause of my insomnia? There are several causes of insomnia, including stress, environments such as noises, light, or temperature, a change in your sleep patterns such as jet lag, for example, or a new shift at work. Now, mental health problems such as anxiety or depression. There's also pain or discomfort at night. Some medications and substance use such as alcohol, tobacco, caffeine, etc. Adding to that, asthma and also hyperthyroidism and restless leg syndrome. Now let's talk about types of insomnia. People suffer from several types of insomnia, including primary. So if you have an insomnia without suffering from any medical disease, it's called primary insomnia. The secondary, if you have insomnia due to underlying various health problems such as asthma, arthritis, depression, cancer, pain, or even some medications and substances such as alcohol, this insomnia is called secondary insomnia. So, what are the symptoms of insomnia? Now, insomnia is characterized by 1. Trouble falling asleep or staying asleep through the night. Then you wake up earlier than usual, a little bit of irritability, sleeping for short periods of time. You may also have poor quality of sleep with many insomniacs, or wake up feeling unrested and end up feeling sleepy during the day. 3 symptoms of insomnia can lead to other symptoms including fatigue, mood change, and irritability. Now you may be wondering, how do we diagnose insomnia? Well, sleep disorder tests are commonly used to diagnose your insomnia, along with other tests that include physical exam, a medical and sleep history to determine the cause of insomnia. Tests used to diagnose insomnia include a sleep diary, which may be useful for the doctor to reach a diagnosis. Also, we may use a polysomnogram, which is a test that measures activity during sleep. Then, Epworth Sleepiness Scale is a questionnaire that evaluates daytime sleepiness. Now, mental health exams are essential in finding the cause of insomnia, as it may be a symptom of anxiety, depression, or other mental health conditions. But don't forget, sleep problems may be symptoms of mental illness. So, mental health exams are very essential in finding the cause of insomnia, as it may be a symptom of anxiety, depression, and other mental health conditions. Let's talk a little bit about complications of insomnia. Now, sleep is a very essential part of your daily life to practice your life actively and energetic. Therefore, complications of insomnia may include poor performance at school or on the job, high risk of accidents, slowed reaction time, increase your risk and severity of chronic conditions such as high blood pressure and heart disease. Now finally, we'll be talking about insomnia treatment. All of the above may be very worrying and frustrating to you, but don't you worry. There's certainly a solution to your sleep problems and there's a cure for insomnia. Now the treatment options can include chamomile, which is a commonly used herb for the treatment of insomnia. The FDA considers it to be safe with no side effects. Valerian root may help inducing and maintaining sleep, but it is not safe for children or during pregnancy. Also, melatonin is a hormone produced by the pineal gland located in the brain, and plays an essential role in regulating circulation rhythms. Some supplements can raise the melatonin level in the body up to 20 times more. Also, acupuncture is also an alternative therapy for insomnia. This procedure involves the insertion of tiny thin needles, sometimes alongside electrical stimulus or heat, into the skin at specific acupuncture points. Some recent studies have shown that therapy helped improve the quality of sleep in some insomniacs. But instead of curing insomnia, can we prevent insomnia from occurring from the start? Good sleeping habits can help prevent insomnia, such as keep a consistent sleep schedule, for example, waking up and going to sleep at around the same time every day. Also, you may have to stay active as regular physical activity helps with preventing sleep disturbances. Avoid limiting naps. Limit your intake of alcohol, caffeine, nicotine, and any recreational drugs, especially right before bedtime. Also, avoid heavy meals right before bedtime. Make your bedroom comfortable by dimming the lights, using candles, or aromatherapy. Also, you can create a bedtime ritual such as reading, listening to music, or taking a warm bath. Thank you for joining us in yet another video covering key health-related topics with Cloud Hospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.